Skin is the largest organ of the human body. Exposure to extreme heat, chemical agents, and electrical shock can burn the skin, causing pain, blistering, and in severe cases, irreversible damage. Burns are classified as first, second, or third-degree burns, depending on the amount and depth of tissue damage. A first-degree burn, or superficial burn, affects the outer layer of the skin and is the least serious type of burn. The skin is usually red with swelling and minor pain. A second-degree burn, or partial thickness burn, causes blisters, and the skin takes on an intensely reddened, splotchy appearance. Second-degree burns produce severe pain and swelling. A third-degree burn may involve layers of skin, fat, muscle, and even bone. Burned areas may be charred black or appear dry and white. Permanent tissue damage is plausible. Extensive third-degree burns can be fatal because the risk of infection is extremely high. In fact, bacterial infection is the leading cause of death in burn victims. Different types of burns include thermal burns, which can be caused by flames or contact with hot objects, liquids, or steam. Electrical burns can cause injury to the skin and internal organs. They occur when contact is made with an electrical current. Electrical burns may look minor, but there may be extensive internal damage. Chemical burns are typically caused by strong acids, alkalis, or other corrosive materials. Most minor burns and small second-degree burns can be cared for without medical intervention. Treat minor burns yourself unless the minor burn covers a substantial portion of hands, feet, face, groin, or a major joint. Or if a second-degree burn, partial thickness, is larger than 3 inches in diameter. In both these cases, seek emergency medical attention. For small minor burns, treat the victim by assuring that the scene is safe and the victim is removed from the burn source. Apply the acronym AID. Remove jewelry if possible, as the area will likely swell and could affect circulation. Cool the burn. Hold the burned area under cool, not cold, running water until the pain subsides, typically about 10 to 20 minutes. If this is impractical, immerse the burn in cool water or cool it with cold compresses. Don't put ice directly on the burn. Use a barrier. Apply an antibiotic ointment once the burn subsides. Loosely cover the burn with a sterile dressing. To treat larger partial thickness burns, assure the scene is safe and that the victim is removed from the burn source. Carry out the acronym AID. Cool the burn. Hold the burned area under cool, not cold running water until the pain subsides. In urban areas, EMS will likely arrive during this treatment. Do not apply ointment until the burn is completely cooled. Loosely cover burn blisters with a sterile dressing, but leave blisters intact. Do not break blisters, because this improves healing and reduces pain. Wrap the gauze loosely to avoid putting pressure on burned skin. If fingers or toes have been burned, place clean, sterile bandages in between the digits and avoid having burned skin touch burned skin. Remove jewelry if possible, as the area will likely swell. To minimize infection, use only clean bandages. Do not use fluffy cotton or other material that may get lint into the wound. Give care to minimize shock. For large, severe burns, after following the acronym AID and assuring the victim's safety, make sure the victim is breathing. If they are not breathing, begin CPR. For major burns, cut away clothing around the burn, but don't try to remove clothing that is embedded into the wound. Cover the area of the burn. Use cool, moist, sterile bandages that are non-fibrous. When a victim has a large, severe burn, the body is less able to regulate body temperature. Therefore, do not immerse large, severe burns in cold water. Doing so could cause a drop in body temperature, hypothermia, and shock. Do not apply ointments to severe burns. Treat for shock. An electrical burn may appear minor or not show on the skin at all. but the damage can extend deep into the tissues beneath the skin. If a strong electrical current passes through your body, internal damage, such as a heart rhythm disturbance or cardiac arrest, can occur. Sometimes the jolt associated with the electrical burn can cause you to be thrown or to fall, resulting in fractures or other associated injuries. Utilize the acronym AID. If the victim is unconscious, consent is assumed. While waiting for medical help, follow these steps. Look first, don't touch. A person may still be in contact with the electrical source. Touching the person may pass the current through you. Turn off the power at its source if possible. If this is not an option, wait for emergency medical help. All materials conduct electricity if the voltage is high enough. Therefore, do not try to move the victim with any object, including wooden or rubber poles. If the scene is safe, check for normal breathing. If absent, begin CPR immediately. In this case, the victim's chest is rising and falling, so we know they are breathing. Cover the affected areas. If the person is breathing, cover any burned areas with a sterile gauze bandage if available, or a clean cloth. Look for the entry and the exit wound. The electric current will pass through the body and exit. Both areas may need care. Treat for shock. Administer emergency oxygen and maintain body temperature. In this scenario, the victim was forcefully thrown, which could have caused spinal or head injuries. Do not elevate the legs. The jolt and impact of the fall could have caused additional injuries. Perform a head-to-toe body exam as learned in the victim assessment segment. If a chemical burns the skin, it will continue to do so until it is removed from the skin. Apply the acronym AID. Remove the cause of the burn. A chemical will continue to burn as long as it is in contact with the skin, so you must first brush off any remaining dry chemical. Rinse the chemical off the skin surface with cool, gently running water for 20 minutes or more. Remove clothing or jewelry that has been contaminated by the chemical. Remove clothing safely so it will not come into contact with other skin. If EMS does not respond quickly, after rinsing for 20 minutes, wrap the burned area loosely with a dry, sterile dressing or clean cloth. Re-wash the burned area for several more minutes if the person experiences increased burning after the initial washing. Minor chemical burns usually heal without further treatment. If a chemical splashes into a victim's eye, take these steps immediately. Apply the acronym AID. Flush the eye with water. Use clean, cool tap water for at least 20 minutes. Rinse contaminated eye downward so fluids flow away from the other eye. Wash hands with soap and water. Thoroughly rinse hands to be sure no chemical or soap is left on them. Your first goal is to get the chemical off the surface of the eye, but also from the hands. Don't rub the eye. Remove contact lenses if they didn't come out during the flush. Know the name of the chemical. Seek emergency medical assistance.